My name is Pregel, and I'm a program advisor for social inclusion and disability at Sightsavers. In this presentation, I will talk about the work we're doing to improve the accessibility of health facilities in low- and middle-income settings using a bespoke accessibility package through a participatory approach. Sightsavers is an international organization working to prevent avoidable blindness and promote the rights of people with disabilities. And one of the key pillars of our approach is the understanding that every human being has the right to enjoy the highest possible standard of health. And this, of course, includes people with disabilities, as also highlighted in the United Nations Convention on the Rights of Persons with Disabilities. It is, of course, also one of the key principles in the Sustainable Development Goals and Agenda 2030. There's a goal on achieving universal health coverage, ensuring that everyone is able to access a wide range of quality health services whenever and wherever they need them without becoming poorer in the process. And the SDGs and Agenda 2030 also recognize the importance of leaving no one behind, reaching the most marginalized people first. Accessibility is really important in this context because physical and communication barriers can prevent people with disabilities from accessing the health services they need. For example, physical obstacles such as steps, narrow doors, steep ramps can really prevent people with physical impairments, for example, from accessing the services they need. Sensory and communication barriers can also be really challenging. For example, information written in small print with poor color contrast, or maybe health facilities with a very noisy environment can make communication more difficult for people with hearing impairments. Or maybe there's a lack of communication of materials in alternative formats such as Braille or large print or easy read or sign language. So all services and products, including in the health sector, should be really designed following universal design principles, ensuring they are accessible to everyone to the greatest extent possible. And this principle is also included in the CRPD, in the Convention on the Rights of Persons with Disabilities. Article 9 clearly says that states should promote equitable access to the physical environment, transportation, information and communications, and all services open to the public, both in urban and rural areas. And Article 9 also states that the states should develop, promote, and monitor the implementation of minimum standards and guidelines for accessibility. Sightsavers has been developing an inclusive health portfolio over the past few years. We've been working with our partners on the ground across multiple countries to learn how best to make health services more inclusive for all, particularly people with disabilities, but also other marginalized groups. We've been collaborating with ministries of health, with NGOs, with disabled people organizations, and we have inclusive health programs across Sub-Saharan Africa and South Asia. As part of this process, we've developed a number of different approaches, an inclusive health model, which sort of underpins our portfolio and our programs across different countries, and a series of different tools. One of these tools is our accessibility standards and audit pack. The original draft of this tool was developed in May 2018 in Mozambique. We developed it and tested on the ground together with disabled people organizations and our partners from the health sector. So we revised the tool together, we took their recommendations on board and their feedback from using it and testing it on the ground, and we sort of developed our first accessibility package. And this was used to conduct accessibility audits in 7 hospitals in Mozambique in the northern province of Nampula. Later on, we collaborated with our partners in Bangladesh, our health partners and disabled people organizations, to revise these tools and sort of make them more relevant for their specific context. And we did the same in Pakistan, working with our partner organizations, and we conducted accessibility audits in multiple hospitals. And all this experience was really, really helpful for us to gather new learnings and experiences and feedback. And we decided to consolidate all of these in a more comprehensive accessibility standards and audit pack, which was finalized in September 2019. And this was later used in Malawi, and we were hoping to conduct more accessibility audits later on across our programs in Nigeria, in Uganda, Tanzania, and Malawi. But of course, because of the coronavirus pandemic, we had to pause some of our activities, and hopefully we'll be able to resume them shortly. Site Service Accessibility Standards and Audit Pack was developed to achieve multiple goals. We're using it within our own programs to assess the level of accessibility of existing health infrastructure. So we conduct the accessibility audits and we provide recommendations and support to make these facilities more accessible. But we also work with our partners to ensure new health infrastructure is designed with accessibility in mind. So whenever they're planning to build new health facilities, we work with them using these tools to really embed accessibility throughout from the design stage. And we're working with our partners in different countries with disabled people organizations to influence governments to develop accessibility standards and guidelines at national level. The accessibility standards and audit pack comes in a simple box. The toolkit itself was designed to be as accessible as possible. So the box has a magnetic piece which keeps the box closed and can be opened just with a finger. And when you open the pack, inside you'll find a number of different tools. The first tool is the Accessibility Standards Manual. This manual includes standards which are based on international standards and universal design principles, and it's color-coded, so each section has a different color, and each section really focuses on specific infrastructural components such as rooms or circulation paths or doors, ramps, accessible toilets, etc. In each section, we provided clear measurements and standards for specific components. So for example, the height of a handrail or the distance from the wall. And we also recognize that the tool needs to be flexible. So we included a space underneath each of the measurements to take note of potentially measurements which are more relevant in that specific context. So we recognize that in some countries, specific standards may be already available and may be different from the ones we've included in our manual. And so there is a space where whoever is conducting the audit can really take note of that specific measurement in their context. And of course, we've included a lot of pictures and diagrams and photos to make the tool as accessible, as user-friendly as possible. Because we also recognize that these could also be used by people who do not have a lot of experience in accessibility, and so we wanted to ensure is our tool was as easy to use as possible. As mentioned, the accessibility standards and audit pack can be used to conduct an accessibility audit, which really is an assessment focusing on. So the purpose of the assessment is to identify existing barriers in a specific environment, such as a hospital, and to provide recommendations to make that specific environment more accessible. Using the pack, a single individual could conduct the assessment, but our recommendation is to put together a team, an audit team, because this adds a lot of value. We recommend to involve people with different types of impairments. For example, someone who has a hearing impairment, someone with visual disability, maybe someone using a wheelchair, someone who has an intellectual disability, or someone with psychosocial disabilities. And to also involve people from the health sector. So for example, someone working in that specific health facility, or someone from the Ministry of Health or the Department of Infrastructure, because this combination of different backgrounds and experiences and areas of expertise can really add a lot of value to the audit process. And of course, the team needs to be trained. So within the pack, we've provided detailed guidance on how to conduct an accessibility audit and how to train an audit team. There are some training tools included in the pack. And as part of the training, we explained that each team member can play a different role during the audit. So, for example, someone can be testing infrastructural components such as pushing a door or using handles or trying to move around the room with a wheelchair. Someone else could be measuring sizes and distances. Someone could be taking pictures, and these photos can then be included in the final report and used as evidence. Someone else could be checking the accessibility standards or using the checklist, which I'll be introducing in a few seconds. All of these, as mentioned, are described during the training process. Normally, the training takes 2 or 3 days, and it includes both theory and practical exercises. So we all gather together, we go through all the tools and relevant materials, and then we go out in the field and conduct some practical exercises to allow everyone in the team to practice and to learn how to conduct the audit and how to use the different tools when in the field. In order to conduct the audit, we've included a checklist in the pack. This checklist comes with the slipboard, which is what we define as the accessible version of a clipboard. So we have removed the metal piece that normally is included in a clipboard, and we've included a transparent plastic pocket at the bottom, and you can simply slide the checklist into the pocket, and you can turn the pages as you go, as you move around the facility, and it just makes it a little bit easier to use the checklist when you're conducting the audit within a facility. The audit checklist is divided again into different sections, which focus on specific infrastructural components. And again, this is color-coded, so it's easier to track different sections across the checklist and across the standards manual. And for each section, there's a number of questions. These questions sometimes require a simple yes or no, or sometimes it doesn't apply. But sometimes the checklist has a reference to the standards manual. And the team is required to refer back to the manual and to check all the criteria for that specific component, and then to take note of relevant information on the checklist. And at the end of each section, there is a space for comments. One of the most creative tools within the pack is the tape measure. This is not a regular standard tape measure. It's a customized 2-meter long tape, which we've produced and printed following a long trial and error process. This was printed on a sturdy, very resistant fabric. On the right hand side, there is a white background with centimeters written in black. And on the left hand side, we've incorporated some visual information, some markers, which sort of highlight some of the key measurements that are normally required during an accessibility audit. So for example, if you are conducting an audit within a hospital, you may need to measure, I don't know, maybe 20 different doors. So instead of measuring the exact width of every single door within the hospital, you can use a simple marker on the tape measure to assess whether the width of the door is within the required standards or whether it's more narrow, and whether it requires to be changed. So it's a simple method. It's a simple added piece of information on the tape, which makes it a bit more easier and more sort of quick during the audit process. Within the toolkit, we also included a USB stick, which has a series of digital tools. One of these tools is the accessibility audit report. So after the audit, all team members are invited to compile the report together to share the notes and observations and recommendations. And the report can really be used to provide recommendations to the health facility management and all those involved in the project to make sort of to improve the accessibility of the facility going forward. As part of the toolkit, we've also included an audit score mechanism. So we have included a scoring card, which is divided into 4 different sections, from minimal accessibility to good accessibility, using a score from 0 to 100. Following the audit, team members are invited to assign a score to the facility using the scoring tool. But before the audit, each member is invited to contribute to the scoring tool itself. So all members are invited to have a discussion and to identify what are some of the key examples of what, for example, minimal accessibility may look like in that specific context. So the team provides a narrative description for all the specific scoring thresholds in the scoring tool. So they define what minimal accessibility looks like, low accessibility, moderate accessibility, and good accessibility. And that can be used just as a reference when sort of assigning the final score to a facility. Each individual after the audit assigns a score, and then they do it in pairs, and then they do it in group of 4, and eventually the whole team manages to assign a single score to their facility. And this can be really useful to provide a snapshot of the sort of adjustments that are needed to make that specific building more accessible. But it can also be used for monitoring purposes, for example, within a log frame, to assess progress against the baseline. Within the digital pack, we've also included an action planning tool. This is an Excel file that can be used to keep track of all the changes required in the facility, all the costs, who's going to be responsible for it. And so using this simple template, the team or the person responsible for the project can keep track of all the necessary information. So for example, what are the recommendations, what is the cost required for that specific intervention, how many units are needed, for example, what is the cost, the total cost, who's the supplier, what is the level of priority of that intervention? Is it high priority, is it medium priority, or low priority? Who's going to be paying for that specific intervention? And perhaps there may be different sources of the funding that can be listed in this Excel file. And then there is space to keep track of the stage of completion, the start date and the completion date. And this tool can be really useful to keep everything in a single place and to keep monitoring the progress of the work as the project progresses. So this was a simple overview of some of the key features of our accessibility standards and audit pack. In terms of next steps, Science Service is now working to build capacity within the organization and to build capacity of our partners to ensure we can really use this toolkit within our programs going forward. But we're also collaborating with other organizations to test the toolkit across different sectors. So for example, we recently collaborated with one of our partners to use this toolkit within marketplaces in Myanmar. The toolkit is available for free download on our website. The address is www.sciencesavers.org/accessibility-standards. You can go to the website, download the pack, all the digital tools are available for free download. You can also request a physical pack. We have a limited number of copies that can be dispatched when needed. And we really do welcome feedback from all those using these resources. So please do get in touch with us. You can contact me at apregel@sciencesavers.org. Reach out to us. Let us know if this tool is useful in your programs. Let us know if you're interested in a collaboration with us and how we can help you in your programs to ensure health facilities are accessible for all. Thank you for listening, and I look forward to working with you soon.